the woman needs to cooperate with the midwife. When I mean the woman needs to cooperate, when the woman is asked to flex her leg, widen her legs, and then bear down with each contraction, the midwife encourages her to bear down gradually so that the baby will be coming out. If the woman does not cooperate, it endangers the newborn, and this can also lead to stillbirth. It can lead to so many factors. It can lead to asphyxia, birth asphyxia. It can also lead to prolonged labor, because the more the woman tends to delay in pushing, the baby may start developing what is known as caput sesagenum, whereby the head will be swollen, or even the module becomes excessive. There are so many other conditions that may arise, which I don't want to talk about. But when the woman is already 10 cm dilated, you follow the instruction of the midwife, and then you bear down. Once the baby's head comes out, the midwife guides it gently, delivers the entire baby, then show the baby to the mother, and then hands the baby over to the assistant who attends to the baby, do the rest of the things. Then that ends the second stage of labor, because it starts from 10 cm dilatation to the delivery of the baby. Once the baby is delivered, the second stage has come to an end. Then we now go into the third stage, which is the separation and expulsion of the placenta. This one does not take long, but is expected to take a period of, let's say, 30 minutes. If it extends that, other maneuvers can be done to deliver the placenta. Once the placenta separates and comes out, blood clots expelled, the woman will be cleaned. If there is an episiotomy, when I mean episiotomy, if there's a cut that was given in order to assist the birth canal to be wide enough for the baby to come out, it will be sutured. Once that is done, the woman will be cleaned up, made comfortable, and then we'll allow her to stay inside the labor room for a period of 1 hour to 2 hours. That ends the third stage of labor. The period of that 1 hour, that period from the third stage of labor to about 1 hour to 2 hours is what we call the fourth stage of labor. It's just a period where you allow the woman to stay in the labor room and you monitor her closely, so that if there's any other thing that can come out of it, something like postpartum hemorrhage, that's bleeding after delivery, or let's say the woman develops any other complication or issue, it will be immediately attended to while she's still in the labor room. If after 1 hour to 2 hours she's stable, you now move both the baby and the mother to the lying-in ward, which is the postnatal ward, where she can stay and then be monitored. Every other thing can take its course from that place, and that is all about labor. Labor is a very interesting part of midwifery, and it all depends on you meeting a skilled midwife, a good gynecologist that will give you the attention you need. It will result to any complication. It's only when an individual does not follow the normal process, which is going for antenatal, doing the necessary thing she is supposed to do, that is only when you find out that, let's say, the course of pregnancy, the course of delivery was not successful. But if an individual has this advice that I just gave right now in her head, she'll be able to understand that if you are coming in for labor, that's to come and deliver your baby, you don't need to be tensed. What you need to do, just pray, come into the labor ward, deliver your baby healthy, sound, and then you take your baby home peacefully. Thank you very much.